So in this video, I'm going to talk about the position of the urinary bladder inside the body. So the bladder is a pelvic organ, it's retroperitoneal by position, and it is normally in an empty state. It is present behind the symphysis pubis. So in front of you is a hemisection through the male pelvis, showing us the bladder and other structures present in the pelvic cavity. And here you can see this is the symphysis pubis, and this is the lower part of the anterior abdominal wall with all the skin, subcutaneous fat, fascia, and then muscles, and then the peritoneum, okay? All right, here is the apex, and this is the ligament I was talking about, originating from the apex or attached on the apex and reaches up to the umbilicus. This is the median umbilical ligament, or urachus, okay? So in normal circumstances, in an adult, the urinary bladder, partially full or empty, is lying inside the pelvic cavity or true pelvis. While in an infant, this bladder, whether it's empty or it's filled, it's lying inside the abdominal cavity, because in the infant, the pelvic region is still growing and it's a small, narrow space, so the urinary bladder is an abdominal organ in infants. And that explains why because due to the pressure, negative pressure of the abdominal cavity, when an infant is peeing, he has a very fast stream, that rushes out because of the pressure from the other abdominal organs. While in adults, the bladder descends down and settles into its normal anatomical position, that is in the true pelvis or the lesser pelvis, okay? Now what happens, I told you that the bladder has a capacity of up to 500 milliliters of urine in one point of time it can hold, okay? As the bladder is filling, I want you to imagine, I always give this example, you imagine the bladder like a sun rising over the horizon, okay? So it is rising slowly. So the fundus of the bladder, as it is getting full, the cavity is getting full, it's getting distended, urine is constantly collecting, so it just, it rises up. And I have mentioned that the superior surface or the fundus of the bladder is covered by the peritoneum from the top. Okay, the peritoneum is not wrapped around the bladder, it's just covering the superior surface. So as the bladder is getting full, it is rising like a sun on the horizon, and it's crossing the symphysis pubis and just peeps out of the pelvic cavity into the abdominal cavity. What is happening as it is getting full, it's getting distended and distended, it's peeling off the parietal peritoneum or the abdominal peritoneum, and it's occupying this area behind the peritoneum or outside the peritoneal cavity, okay? It always stays outside the peritoneum, we have to keep in mind. Sometimes what happens in small children and also in adults, there is extraordinary retention of urine, like in cases of BPH, like benign prostatic hyperplasia, or any situation that leads to obstruction, urethral obstruction of some sort. So there would be chronic retention of urine, and when it reaches, it's getting more and more, it's peeling off the peritoneal layer from the anti-abdominal wall, and it's becoming an abdominal organ. So they perform a cystotomy, like they insert a needle to relieve the pressure. So how do they do that? They cross through the skin, the campers and superficial fascia, both elements, the scarpus and campers, and then the linea alba, which is the bloodless line, the avascular line present in the mid of the abdominal wall, that is below the umbilicus, and then the fascia transversalis, and they reach to this level, which is the bladder wall. So the needle has entered the swollen or distended bladder wall after crossing all these structures, and the urine can be aspirated out to relieve the pressure and prevent the bladder from rupturing. Okay? So it's important to understand. By the way, a full bladder can reach up to the level of umbilicus. Although it's a pubic or a pelvic organ, it's lying behind the symphysis pubis, but when it starts getting distended, it can distend up to so much that it reaches the umbilicus. Okay? But there are chances of rupture in case of if somebody has blown someone's abdomen in the region of distended bladder, so the anterior bladder wall will rupture and the urine can get collected here in the subcutaneous tissue, which is fascia and fat, and can cause problems.